The difference, I think, with our practice, with other practices where you see two surgeons, is we work actually together on every single case. This is not the case where, maybe Dr. Litner is doing the breast augmentation and I'm doing rhinoplasty cases. In every single case with every single patient, both of us are involved in the decision-making process in making sure that the result that we promise to that patient is what we get.
Yeah, I think it's a really unique collaboration. In most other interactions, there's either surgeons who are trained in different areas coming together, or there's a surgeon operating with a trainee, a resident or fellow, who really isn't in a position to be critical and honest about how the procedure is going. And I think by having two double board certified ENT and facial plastic surgeons really collaborating on every single patient together, it allows us to be very honest and critical of our results and really make sure the focus is on getting the best possible outcome for the patient.
And I think that's really the fun part of our practice is, if you actually were in the operating room, you'd see that we would argue. We actually really criticize each other. We're very critical of each other. And it's not about our egos. It's not about my personality or Dr. Litner's personality. It's really ultimately about the patient. And what it's allowed us to do is bring together the techniques that Dr. Litner was taught that I wasn't taught, and things that I was taught that he wasn't necessarily originally taught, and really try to mesh and figure out in which patients each of those procedures work best with. And that's really allowed us to expand the practice so that we have patients from Africa and Europe and the Middle East and Asians and Hispanics and people from all over the world come to us, and we're really able to tailor the procedure uniquely for each one of those individuals. And I think that makes all the difference in the way our practice works.
Yeah, if you were to be in our operating room watching us, we'd look like an old married couple. We're arguing across the table at each other, and we have a lot of fun with it, but I think a lot of that comes from the idea of making sure that the patient's getting what they want. And the job of the surgeon who's kind of taking a step back and not operating is to be the patient's best advocate and to make sure that with each step we're getting exactly closer and closer to what we image for them.